It is my honor to welcome you to our webinar this afternoon, where we will dive into the understanding of our latest Central Ohio Child Care Provider Survey report, Dedication Through Difficulty. I will be serving as your MC today, along with my colleague, Marketing and Communications Manager, Christiana Soulard. As the local child care resource and referral agency for Central Ohio, Action for Children is committed to assuring quality learning experiences for all children. For over 50 years, our services have focused on transforming the lives of children in SDA 9 by supporting the everyday heroes who most influence our children's early growth, and those, of course, are caregivers, educators, parents, and guardians. On September 9th, 2024, our online survey was distributed to 1,241 licensed providers in Central Ohio counties, which include Delaware, Fairfield, Franklin, Licking, Madison, Pickaway, and Union counties. A total of 415 responses were collected. Making up those responses were 259 child care centers and 156 family child care homes. Our results are statistically significant, with a 95% confidence with a margin of error of 5%. The qualitative data was gathered through open-ended responses to understand the real-world perspective of the findings. Today, you'll be hearing from Action for Children board member and professor of economics in women's, gender, and sexuality studies at The Ohio State University, Dr. Joyce Chen, and Action for Children Director of Child Care and Education Initiatives, Dr. Catherine, or Kat, Glenn Applegate, and Action for Children Data Analytics. A few housekeeping notes before we get started. We ask that all attendees stay muted and have cameras off. If you would like to submit a question, please use the chat button located at the bottom of your screen at any time during the program. Christiana will be monitoring the chat, and we will get to as many questions as we can during the Q&A portion of our program. Pre-submitted questions will be answered first, and some pre-submitted questions have been worked into our presentation. If we are not able to get to your question during the program, don't worry. We will send a list of those questions submitted along with those answers with the recording of the webinar to all of you by the end of this week. And with that, it is my pleasure to welcome Dr. Kat Glenn Applegate. Kat.
Thank you so much, Natalie. And thank you all of you for being here today. First and foremost, I want to thank the 415 programs who responded to this survey. This work, this information is not available without all of them sharing their voices and sharing their experiences. And of course, I need to thank Dr. Chen, Ryu Tan, for their excellent work on this report. I want to thank Ann Lockett, our interim CEO, along with Dana Wright, Natalie Atkins, Christiana Soulard, and my other excellent Action for Children colleagues and board members who fact-checked and provided feedback on this report before releasing it to all of you. So with that, let's dive in. I want to give you a brief history of the survey and why we do it. Dedication Through Difficulty is Action for Children's 6th survey. We launched the Central Ohio Child Care Provider Survey in 2020 to hear firsthand from early care and education professionals what they were experiencing and what they needed, having been thrown into that pandemic that we had. During that time, we heard a lot about child care professionals being recognized as heroes, which of course they are, but the circumstances that maybe brought that recognition about are still here today, even though the pandemic is often in our rear view window. So the community learned something from that time, and we hope it sticks with us. Childcare is the workforce behind the workforce. So while we do our report annually now in the fall. Again, this is a 6th iteration in 4 years. Now we do it every fall. But those challenges and risks definitely persist, even though the pandemic is behind us. Now, importantly here, you don't have to be interested in early care and education to be interested in childcare. You might be here today because you're focused on healthcare or sales or microchip fabrication. But if your industry relies on workers, then your industry relies on childcare too. So we'll get to this a little more in a moment here, but something you'll hear today is that more than half of all childcare programs in Central Ohio do not bring in enough dollars to cover their monthly expenses. It's half. So when a childcare program goes under because they just can't make ends meet, you're likely to lose your employees that rely on that childcare too. So here at Action for Children and elsewhere, we've long talked about high quality childcare as brain building. That early care and education builds the architecture of the brain during its busiest and most malleable time in life, those first 5 years. Young children's early life experiences, including high quality childcare and early education, are not just key for kindergarten readiness and life support, but can be a literal life changer. Now, that research has been around for years. We know that early care and education is good for children and the students and adults they grow to be. At the same time, childcare is also a civic necessity for a strong economy. So fortunately, we don't have to make the choice between childcare as an early learning support for young children prior to school entry and childcare as a support for working parents and other primary caregivers. It is and it must be both of those. So we do this report every year to give the Central Ohio community a glimpse at the back office workings of childcare programs, what's going on that many folks don't typically see. We also think it's really important to amplify the voices of childcare professionals who are doing this work, even as we have this conversation now. And we also want to empower decision makers like some of you with this timely information that you can use to enact real meaningful change. So with that, let's get started. So I'm going to pass it over to Dr. Chen.
Thank you so much, Kat. I just joined the board of Action for Children this past October, and I'm so excited to have been able to work with the team on producing this report this year, using my background both in economics and in women's gender and sexuality studies. So thank you all. So just to recap, I want to bring back an image from last year's report that shows us the real vicious cycle that childcare providers are facing, right? Low wages lead to staff shortages, which then lead to low enrollment rates, which then lead to revenue shortfalls, right? Providers can either respond by increasing tuition or lowering wages to their staff, but both of those strategies are going to further exacerbate low enrollment rates and leave providers in this impossible bind. Right? Childcare providers have high fixed costs for facilities and materials and face strict staffing requirements, so operating below capacity significantly reduces profit margins. So here we can take our first look at provider confidence. We see that 11% of childcare providers report they're unsure if they'll be open in the next 3 months. This is an improvement since 2020, and that's pretty clear across all counties. And while this trend suggests that providers are slightly more confident in the short term, nearly half, 48%, of all providers in Central Ohio are still unsure if they'll be open in the next 12 months without additional public support. This is down from 54% in 2023, but still way too high. Franklin County providers appear to be particularly at risk of closure, and certain groups of providers are particularly vulnerable as well, including family child care programs, programs accepting publicly funded child care benefits, and newly established programs. So if we take a look at revenue versus expenses, we can see that, or based on our historical data between 2020 and 2022, the proportion of programs reporting monthly losses did decline substantially from 68% to 50%. But since then, since 2022, this number has started creeping up again slowly. So currently, over half of the child care providers responding to our survey reported that their monthly revenue does not cover their expenses. And this is 3 percentage points higher than it was in 2023. Delaware and Fairfield counties experienced dramatic increases in revenue gaps since 2023, and Franklin and Licking counties have remained more stable on this metric. Note that this is also not for lack of trying, right? For the third consecutive year, nearly 2/3 of all childcare providers have reported raising tuition in the past 12 months, and 52% of those report planning to raise tuition again in the next 6 months. So any sector in which half of the businesses are operating on a monthly loss is at risk. And when that sector is childcare, the workforce at large is threatened. So the other piece of this vicious cycle, right, are these staffing challenges. Okay, we have 64% of childcare centers and 46% of family childcare programs looking to hire. And so we can see that staffing continues to be a key challenge, although it has been improving steadily over the last 2 years. The improvement has been fairly modest, though. From 2023, we've gone from 66% looking to hire and 41% respectively for centers and family child care programs. So only a modest improvement and reflects the ongoing staffing crisis for child care providers in our area. If we extrapolate these numbers out for the entire Central Ohio area, we would need approximately 1,456 staff members needed to fully staff our childcare centers and another 131 caregivers for our family childcare programs in order to continue providing quality care to the children in Central Ohio. Next, we take a look at staff compensation. Wages in the childcare sector have always been relatively low, and a lot of people are in this work, of course, because they love it. And given that the US economy experienced record high inflation in 2021 and 2022, we wanted to look at whether pay for childcare providers has kept pace with that. It clearly has not, as these two figures show. In order to have spending power equivalent to that in 2019, median hourly pay for assistant teachers in the Central Ohio area would need to be at least $1.64 higher per hour, and pay for lead teachers would need to be at least $2.59 higher per hour. So those are substantial gaps, right? And then when we compare this with United Way household survival budgets, we see that for a family of 4 in Franklin County with two children and full-time childcare, the household survival budget is roughly $46.83 per hour, right? So 2 lead teachers in Central Ohio would not be able to meet that household survival budget. So we also want to dig a little deeper into our more vulnerable provider groups, starting with a spotlight on publicly funded childcare. So publicly funded childcare is a needs-based program. To qualify for PFCC funding in Ohio, a family must have a yearly income of less than 146% of the federal poverty level. So currently that's about $36,500 annually for a family of 3. To help ease the benefit cliff around that, families that do not qualify for PFCC but earn less than 200% of the federal poverty line may qualify for the Child Care Choice program and apply for those vouchers. In July 2024, fortunately, PFCC programs in Ohio began reimbursing at the 50th percentile of market rate in order to comply with federal standards for funds received through the Child Care and Development Block Grant Act. And then step up to quality participants are eligible for slightly higher reimbursement rates with a 10% bonus for bronze, 15% for silver, and 25% for gold. So one thing to note here is that currently PFCC is reimbursed on attendance rather than enrollment, which makes absences much more costly for providers. So we can see that programs that accept publicly funded childcare payments are more likely to report a revenue gap. And when they have a gap, it's substantially larger on average than for non-PFCC programs. PFCC programs are also at substantially higher risk of closing. Right? We see 12% in the short run, 3 months, versus 5% for non-PFCC programs, and 57% in the next 12 months versus 11% for non-PFCC programs. The good news is, though, that PFCC will go to reimbursement based on enrollment beginning in July 2026. So that should help the bottom line for these PFCC providers. Okay, looking a little bit at their operations, we can see that PFCC programs are more strongly committed, much more strongly committed, in fact, to step up to quality, with 88% participating compared to only 29% of non-PFCC programs. Enrollment at PFCC programs also tends to be closer to capacity, particularly for family childcare providers who often can provide greater flexibility for the families that live near them and also serve many of our communities with the greatest need. And now I'm very pleased to turn it over to Ryu Tan, the data analyst at Action for Children, who produced all the lovely figures and graphs that we're looking at today and that are shown in the report.
Thank you, Joyce. Hi, everyone. My name is Ryu. I'm the data analyst at Action for Children. It is my pleasure to give you a peek into what we have learned from our 2024 Central Ohio Child Care Provider Survey report. Child care providers have many characteristics. There are home type programs, and there are child care centers with many classrooms and many teachers. Some of these programs have publicly funded childcare agreement, allowing them to serve families qualifying for PFCC subsidies. Some of them do not have a PFCC agreement and serve private pay families. This year, we looked into the factor of age, meaning how many years a provider has been licensed. In the market of childcare, every year, there are many passionate and dedicated early care and education professionals flowing into the industry. Unfortunately, this crowd is also particularly vulnerable to financial hardships than established programs that are older than 3 years old. And they're more likely to go through greater trouble at stabilizing their business to make a steady profit. Among our surveyed providers, 17% have been in licensed programs for less than 3 years. The average capacity is 77 at new childcare centers. By new here, I mean they've been open for less than 3 years, and I'll continue to reference them as new here. And the capacity at established childcare centers is on average 105. And the number of enrolled children on average at new programs is 47. So we have this rate of 47 out of 77 of enrollment at new centers. And for established centers, it is 69 children out of 105, their total capacity. So we can see that new centers not only have a more limited capacity, but also have fewer enrolled children. This may be because that programs under 3 years old tend to not have as many resources when it comes to recruiting or retaining families, or that they're still struggling to make their presence in the market. We did notice that 47%, or almost half of established programs, say that their monthly revenue could indeed cover their operating expenses in the past year. By comparison, though, only a third, or 33% of new programs, say that their monthly revenue could cover their operational costs. So by that, we can really see new programs tend to struggle more in being able to turn a profit comparing to more established programs. Though I am not one to downplay how an industry where you have almost half of providers struggling to make a profit is not a healthy industry. Another question we asked to our surveyed programs is that under current operations, how long could you keep your doors open without additional public support? The proportion of those indicating they will have to close without additional public support decrease with the age of the program or how long they have been licensed or in business. 21%, or about a fifth, of programs older than 30 years are concerned about closing without additional funds. So that is 1/5. But half, or 50%, of 11-year-old to 15-year-old programs are worried about closing without additional funds. This number is particularly staggering for programs under 1 year in age, where 69% said that they're worried about having to close without additional public support. A quick throwback to a previous moment when Dr. Joyce introduced us to what publicly funded childcare is. A family to be able to qualify for publicly funded childcare have to make an income of less than 146% of the federal poverty level. To bring that to home, that is $36,500 per year for a family of 3. When it comes to the PFCC, publicly funded childcare agreement status of our providers, 93% of new programs have a PFCC agreement. This suggests that newer programs are serving populations with particularly high needs. Given this intersection of new programs being new to the childcare industry, and they're serving families that rely on PFCC subsidies to be able to afford childcare, we advocate for prioritized support for programs serving low-income families. Another disparity we observed between programs under 3 years old versus programs that have been established for more than 3 years is that newly established providers are less likely to offer a competitive staff compensation. From our survey data, we see that the average highest hourly pay for lead teachers is $16.34 per hour at new centers, whereas at established childcare centers, the average highest pay for lead teachers is $18.85 per hour, and that is more than $2 per hour of a difference. Remember when Dr. Joyce talked about the vicious cycle? The challenges faced by providers are an interconnected cycle, including not enough staffing, not enough enrollment, and not enough revenue. In our current world where Amazon workers make more than, or as they advertise, $20 on average per hour, early care and education professionals that care for children are severely underpaid. When wages are less than ideal, early child care professionals can find themselves in a bind between a career powered by their passion, expertise for teaching, and being able to pay their bills at home. When childcare centers cannot offer a competitive wage, the childcare industry can suffer from staff shortage. Like, why do you study to become a childcare teacher at a center when you can make the big bucks doing a lot of other things? So that is not particularly incentivizing for young professionals. And now, without enough staff, centers cannot utilize all their available space, classrooms, and cannot enroll as many children as their total capacity allows. The high operational costs this accrues at the same time force providers to have to raise their tuition year after year just to cover that revenue loss. And in turn, with the tuition rates climbing, families as a result find it very difficult and increasingly difficult to be able to afford enrolling their children into a licensed childcare program, leading to more revenue loss and then staff shortage for our providers. Childcare industry has been a broken industry. Unless we break the cycle, this industry cannot regain the economic vigor it deserves. In this cycle, newly licensed programs that are less than 3 years old are especially vulnerable. When even being able to keep their door open is a big issue, new programs can really truly benefit from getting more public support so that they can secure their footing. So next up, I'm going to pass it back to Dr. Catherine, Director of Childcare Education and Initiatives at Action for Children, to talk more about Step Up to Quality program.
Thank you so much, Ryu. Yeah, so I somehow won out in this webinar because my excellent colleagues have shared some really hard, some really difficult information. I get to share some good news coming up here next. Before I get too deep into that, here's a little bit of context about Step Up to Quality. Step Up to Quality is Ohio's Quality Rating Improvement System, or QRIS. Most states and territories have a QRIS in some form or another. Here in Ohio, we have Step Up to Quality. As of October 2024, a couple months ago, 64% of the approximately 1,300 childcare providers in Central Ohio participated in Step Up to Quality. When we look just at our survey respondents, we have a slightly higher rate with 77% of our survey respondents participating in Step Up. Next slide, please. So Step Up to Quality has gone through several iterations over the years since it was first piloted in 2004. Most recently, in March of 2023, there were some changes made that significantly impacted both who must participate in Step Up to Quality and how that looks. First, all family childcare programs were made exempt from participation in Step Up to Quality. Second, centers whose enrollment of PFCC-funded children was less than 25% of their licensed capacity were also made exempt from participating in Step Up to Quality. Third, the Step Up to Quality standards were significantly revised. So first, we moved from a 5-star rating system to a 3-level system. So those red stars that you may be familiar seeing outside of childcare programs are being replaced now by bronze, silver, and gold ratings. So the changes to the Step Up to Quality system, those standards, those are significant. And in most respects, those expectations have increased. I've participated in some sessions on those new Step Up to Quality standards, and that's 3 hours in itself. So we're not going to go into the details of those changes today, but suffice it to say that newly rated programs and programs that were rated under the previous 5-star system and now have to meet those higher standards to earn or retain that bronze, silver, or gold rating, they have a challenge ahead of them. Next slide, please. So looking at this, let's think about those FCCs who are no longer required to participate and those centers who serve less than 25% PFCC, thinking about those groups at this moment in time. That means that in October of 2023, when those changes were put into place, there were 266 programs who had earned their Step Up to Quality rating, but were no longer required to participate. So we looked at that group between October 2023 and October 2024 to see how many of those programs remained in Step Up. In that year, only 3.7% of those programs stopped participating in Step Up. That's about 10 programs. So the 266 that were participating but no longer had to, about 256 of them maintained it. In that same year, a lot more programs became Step Up to Quality rated, including 31 programs who were not required to be rated under these new rules, but they still earned that initial rating. So what we see there is that programs that had that Step Up to Quality rating and didn't have to keep it, they pretty much all maintained it. And then they had more than 30 additional programs who joined them. So we know from our day-to-day work here at Action for Children that there's diversity in thought about Step Up to Quality, but holistically, we see that programs really value the Step Up to Quality system. Next slide. So now digging back into our survey, we found something that I'm really excited about. Our survey asked all programs who are participating in Step Up if they plan to continue to participate in Step Up to Quality. 98% said yes, they were. So that's a huge majority of folks all plan to continue with Step Up to Quality. In fact, 60% of all rated providers plan to increase their rating. That's the light blue that you see there on your screen. 38% plan to maintain their current rating. That's the dark blue or the purple there. However, when we look a little more closely at that 38% who want to maintain, more than half of those programs are already gold rated. That's the highest rating in the new system. So here too, this shows really impressive commitment to the Step Up to Quality system. So next slide, please. We asked Step Up to Quality programs why they chose to continue to participate in Step Up to Quality. And they had a lot of things to say about it, but their response is really centered on 3 related themes. First, they value Step Up to Quality because they value quality, pure and simple. The professionals who responded to our survey prioritize quality, and that lines right up with the Step Up to Quality system. Second, professionals value the higher reimbursement rates they receive for being rated. As Dr. Chen mentioned earlier, bronze, silver, and gold get an additional reimbursement for that higher cost of quality. We know that quality childcare costs more, so programs receive higher reimbursement rates as they move up that bronze, silver, gold ladder. And third, we heard from programs that they see Step Up to Quality as a way to attract new families. So going back to that enrollment theme that we heard earlier, these are programs that are proud of their Step Up to Quality rating and use that as a recruitment tool to bring in new families, and as well as to help elevate their place in the community that they serve. To me, those three are all really interrelated. Quality, being reimbursed for the high quality care that they receive, and being recognized in their community. So that's some good news that we're seeing. We also know that those programs with those higher standards that I mentioned, they're going to need support. They're going to need help to achieve those goals. They are motivated, they want to do it. They're going to need support from the community around them and the community that relies on them to achieve those goals. So now we're going to move on to some next steps. Here's what you all can do, whether it's long-term, short-term, or as soon as you get off the webinar here today. So first, we need to increase financial supports for childcare providers. So as you heard, we need to support those providers who have a revenue gap between what they bring in each month and their costs. That just can't be maintained. We have to support those programs. We need to prioritize supports for programs that serve those low-income families especially. And an important way that we can think about doing this is thinking about wage enhancement programs for those professionals that are working with children, building those brains every day. We need to combat that low compensation that keeps classrooms closed, that makes programs closed, and keeps families out of care. Second, we need to expand access to affordable care for families. Next slide, please. Support additional and sustained financial assistance programs for families who do not qualify for PFCC, but still struggle to afford care. So as was mentioned, there's a new Child Care Choice Voucher program. We really want to see that program be sustained to help ward off that benefits cliff that too many families experience. Another thing that we can do is offer childcare benefits through employers. So businesses can offer partnerships with childcare programs that may look like even something as big as starting an on-site childcare program, or it could be supporting a nearby childcare program or providing vouchers to their employees to put towards their childcare costs. That's going to address both that childcare affordability issue, and it's going to address workforce shortages that a lot of us are seeing right now as well. Third, we need to enhance enrollment and utilization. So as we heard, there are some programs that are under enrolled, and we know that there are programs that have closed or programs that even just have empty classrooms that are available but not used. So we need to provide startup grants for programs that are starting in high need areas, and we need to provide funding for equipment, materials, and staff for programs that have unused spaces that could potentially open in those high need areas. We also need to support shared service networks and childcare business supports that can help childcare programs grow and flourish on that administrative side to help them manage their budgets and their finances so that they can make that bottom line livable for all of them. We're really interested in launching a full public service campaign on the benefits of high quality childcare, and hope that some of you will join us in that effort too, because we know that high quality childcare is critically important for children, again, in the short term, in the long term, and it's also important for a healthy a healthy economy as well. So next, we want to encourage you to continue to support Action for Children's advocacy efforts. Of course, we're happy to take your monetary donations, but there's many ways that you can support beyond that too. First, read and share this report. It's linked for you in the chat, and the path is there on your screen. This is really important work, and we want to appreciate the more than 400 providers that shared information with us by getting the information out to all of you. I hope that you'll read the report and share it through social media, through your networks and your communities, and have this conversation. Maybe it's with a friend or a family or even your employer about the importance of childcare in our community. So thank you all so much for your time, for giving some attention to this. And with that, I'm going to pass it back over to Natalie, and we will take your questions.
Thanks, Kat. And thank you to Dr. Chen and to Ryu for this amazing presentation. But now it's your turn. You get to ask the questions. As stated before, use the chat function at the bottom to submit your question. Christiana will read those as they come in. We do have some pre-submitted questions, so we are going to get to those first while you digest and think about how you want to ask your question. So with that, Christiana, what's our first question?
All right. So we have some really good questions here. Our first question, this is for Kat, if you want to jump on camera. But our first question is, well, obviously we've heard a lot about childcare. We've heard a lot about the issues and the challenges. We have this new report. What is the plan for Action for Children? What do we want to do in that next year with the data? And how can we work towards solutions?
Great. I love that so much. You're right. We don't want to just collect this data and tell you about it and then go back to, what we've been doing and put the data in the file cabinet and never look at again. Instead, we've got some really good things coming along. So to start with, as I mentioned, we have childcare professionals who are looking to maintain their step up to quality standards and increase their step up to quality level. And they're going to need some support to do that. So they're motivated, they're ready, they want to do it, they need help. Action for Children has a great team of coaches here that are ready to provide those supports. We've already done some workshops all over Central Ohio in partnership with the Department of Children and Youth. And starting in January, we have working clinics for those childcare programs to help them better understand the new step up to quality standards and understand the changes that they need to make in their personal individual program to increase their standards to continue to align with those. We also have some other excellent professional development events coming up. We have an event in February dedicated to trauma-informed care. That one's going to be virtual, but we have an in-person one at the Columbus Museum of Art in June, focused on creativity and imagination. We also have a really nice collection of business supports that I mentioned. We have, programs that we want to help them secure their bottom line. So we have programs coming up on starting a family childcare program, starting a center. We have a great one coming up on figuring out your taxes. And we have a program coming up about managing the financial health of your childcare program. As you heard today, that's a big need. So we have lots of things coming up that we're excited about. The last thing that I want to mention is that we have a fairly new program here at Action for Children called the Child Care Business Partnerships. We're really excited about this. This again is a partnership with the Department of Children and Youth. This is an opportunity where businesses who want to support their employees, who want to attract and retain their employees, can subsidize their child care for those employees. Action for Children is in the position to help make those connections between that business and those childcare programs. And do that kind of back behind the scenes logistic work to make that work for businesses. And we're really excited about the opportunities that are there for that. And it's a really tangible, concrete way that our business leaders can make a difference and help support this problem that we are working with in Central Ohio.
Thank you for that answer, Kat. There's a lot of exciting things happening. We have a question that was added to the chat. Charita is asking, I believe this is in reference to PFCC, but we talked about a program that will be starting payments based on attendance or enrollment rather than attendance. What year will that start?
I can take that too. So the publicly funded childcare program, again, it's gone through several iterations. We can find a link to drop in the chat too that has the manual procedure level letter from the state of Ohio that'll give the most up-to-date and detailed information straight from the source. But the publicly funded childcare program has undergone several changes that are going through multiple bits are happening at a time. So while the attendance portion being reimbursed based on enrollment rather than attendance, I believe that's starting in summer of 2026. And some of those reimbursements have already gone into effect, but I'll make sure that I find that link and put it in the chat for you.
All right, thank you. All right, and then we have one last question that is related to Step Up to Quality. I know they're asking with these challenges with Step Up to Quality, how do you account for programs making the decision to continue with Step Up to Quality? All right, Kat, if you want to take
I think
that one.
that one's me too. Um, that's another great question. There are a lot of challenges, and frankly, there's a lot of barriers in the way to maintaining Step Up to Quality. But I think it really comes down to that we have a group of people who are passionate and committed about and want to do what's right for kids. They want to help these families. Um, if you think about, let's say, a family childcare home provider, she only cares for 6 children at a time, and she sees those families coming in every day, knows their stories. She might take care of those children from birth through school entry. So there's a real strong connection there. That's a very personal and deep connection, and that professional is going to want to take care of those kids. So it really comes back to that idea of prioritizing quality. These are early care and education professionals. These are teachers. These are not babysitters. These are people who are dedicating their careers to this important brain building work. So there are a lot of barriers to maintaining or increasing their Step Up to Quality rating. However, it is also about increasing quality, and we have professionals that are really committed to that.
All right. And on that note, I'm not seeing any other questions. If you do have a question, feel free to add it to the chat. But I'm going to turn it back over to Natalie on that great positive note.
All right, great. Thanks, Christiana. I appreciate it. All right. So, with that being said, and seeing no one actively typing in the chat to get another question, if you do have a question and we're able to kind of work it through and get it into the chat, you are more than welcome to reach out to us to ask that question directly. But in the end, I would like to thank all of you for joining us today. And thank you to our amazing panelists. And again, if we didn't get to those questions, feel free to contact us. This recording is going to be sent out to all of you by the end of the week and will be available on our YouTube channel. So feel free to share that once that goes live. With that, have a wonderful day, everyone, and continue to do good.